Welcome to another episode of Your Faith in Health Community. I'm your host, Pastor Jackie Jackson, and as always, on behalf of myself and our producer, Anita Alexander, we want to thank you for taking out time from your busy day to spend with us. Hopefully, prayerfully, we'll give you some information that will improve your quality of life. Now, before we jump into these awesome guests that we have here today, in fact, I think the last time we were together, I gave you a little break and I didn't push so hard. But open enrollment for healthcare or for your health insurance is getting ready to start again in November. If I remember correctly, it's going to run from the beginning of November to maybe December 15th. So if you have not enrolled in health insurance, and I don't know why you haven't, you still have time if you have had a change of life event. So in other words, if you've recently gotten married, divorced, had a baby, recently moved into the state of Ohio, recently came home from a penal institution, jail for those who didn't want to get what I was talking about, or you just lost your job or you're starting a new job, you can go to the marketplace if you have a new job and get enrolled for health insurance. If you are single and you have an income of $16,248 or less, if you're single, that makes you eligible for Medicaid. Beautiful thing about Medicaid is there is no closed enrollment. You can enroll in Medicaid year-round, all year. You know this because I say it all the time. Now, if you have a family of 4, and I want you to get this, if you have a family of 4 and your total income for that family of 4 is $48,500 right in there, that makes your entire family eligible for Medicaid. That is dental, doctor's visits, emergency room, medication, mental health, if you need that. It covers it all. I mean, vision. If you're like me and you need glasses, it can cost a fortune. But if you're enrolled in Medicaid, you don't have to worry about it. Now, going to the marketplace, Obamacare, whatever you want to call it, is a little bit different. This means that if you're single, your income is above that $16,248, somewhere right around there. That means you need to go to the marketplace and you need to shop for insurance. If you've never done it, it could be a scary thing, and it really can be. But here's what's beautiful. They have people on that line that speak 125 different languages. Well, not one person speaking 125 different languages. But whatever your language is, there is most likely someone there that can help. Now, if you speak a language and don't understand English, what I'm saying makes no sense to you. But if you know someone that has that issue, there's a language barrier, let them know that they're covered when they go to the marketplace. And the beautiful thing is there are different tiers of insurance. And the reason I'm pushing this even more today is because open enrollment is starting. And when you look at the violence that's going on, you never know when you or your loved one, I hate to say it, but let's just be real, this is what we're dealing with. When you or your loved one may need doctor's care, and you've got the pandemic going on, God forbid that you contract it, it can cost a fortune. I remember I was in the hospital with heart failure, congestive heart failure. I was in there for a week. My bill came, it was almost $100,000. You don't want that to happen. So, hey, I'm going to back up. I'm going to keep on you on this. Get insured. If you don't do it for you, do it for the people that you love. And if you don't do it for them, do it for me so I can stop telling you about it. All right? Thank you. We've got some awesome people here today. We have with us the Urban League of Greater Southwestern Ohio. Specifically, we have the executive director for the Community Police Partnering Center, Mrs. Dorothy Smoot. We have with us, and then I'm just going to keep going that way. I guess I'll go clockwise. I wanted to be different, but I'll just keep going. We have with the Community Outreach Advocates, Elder Tony Hill. We have this young lady that I'm just meeting today that has jumped into this battle or into this service. Tiffany, tell me your last name again, Tiffany.
Brown.
What is it?
Brown.
Brown, Tiffany Brown, I should have remembered that. Brown, Tiffany Brown. And then we have this rascal over here right next to me, Derek Rogers. So I want to thank you all for coming out and being with us today.
Thank you for having us.
Thank you.
This is exciting, it's really good, and it's important to talk about what's going on in the community, especially what's available in the community, because a lot of people don't know. You know, you would think people would be aware of all the services, but people aren't aware, and people aren't even aware to a degree what's going on in their own community. So having everyone here is a good thing. And I'm going to start with the boss, because you always start with the boss, right? I'm going to start with Mrs. Smoot here to talk about the Partnering Center. For people who don't know, what exactly, and this is important, what exactly is the Community Partnering Center and its relationship to the Urban League?
Well, the Community Police Partnering Center is part of the Urban League of Greater Southwestern Ohio. We have two programs inside of that of our program at the Partnering Center. One is community engagement specialists who work directly with communities to help them address problems of crime, disorder, and quality of life. Help them address issues of crime, disorder, and quality of life, which means we provide technical assistance, resources, we'll help them organize. We want to be there so that they can learn how to help to make their community safer. We also have community outreach advocates who joined the Partnering Center in December of 2019. These men and women are on the front line in our community when there are what we call critical incidences, times when there might be a homicide, a shooting, or when there might be instances where emotions are running high. And they're in the community to serve as individuals who try to de-escalate those scenarios so that we don't have people hurt, arrested, so that they're able to express themselves and get information, but also do it in a way that is community friendly.
Okay, so let me ask a question. How long has the Community Police Partnering Center been around?
The Community Police Partnering Center started in 2002 as a result of the collaborative agreement. It was one of the principal ideas that was expressed in the collaborative agreement that community, police, and stakeholders should address issues collaboratively, work together, that everything is not a policeable matter, that some things are community issues, and when the community can identify those things and find ways to address them, fewer people, again, I go back to fewer people are arrested, more people are safe and healthy in their community, and there are better relationships that exist between the community and the police.
And so since 2002, and I'm not asking like for numbers specifically, but how successful would you say this program is?
Well, we have a 18-year history, and so I really couldn't even begin to give you those numbers right now.
Well, come on, just rattle them off the top of your head.
But I would tell you that on average, we serve about 1,000 individuals in communities with the staff that we have. That I have 2 community engagement specialists and myself. We serve about 1,000 individuals in the community, about 9 neighborhoods a year in problem solving. The outreach advocates who are new to to my organization, I can tell you what they did in the last 6 months. 6,542 people they've provided outreach to talk about the services that they can offer. They also distributed PPE, which are the masks in the community, because at this point in time, not only are we fighting violence, but we're fighting a virus. And so they were on the front line when many people were at home.
Okay, so you mentioned about the community engagement. So what I'm gonna do, and guys, I'm just gonna do ladies first, if you're okay with that. I'm gonna bounce over here to Miss Tiffany Brown. Got your name right that time, right? And talk to us, since I see that you are a community engagement specialist. What does that mean?
As a community engagement specialist for the Community Police Partnering Center, my role is to identify leaders within the community to help them to address issues of crime, safety, and quality of life. We do neighborhood scans. We go to whether it be a park or whether it be a certain street in a neighborhood, and we scan that area for potential threats or issues, whether it be litter, whether it be certain types of crimes or perception of crime. But we help the community make sure that there's a diverse population involved in identifying the problem and responding to the problems.
Okay, so when you say, and I guess I have a part question. One is, so you're going out, you're identifying, like you say, maybe crime, maybe litter. So once you identify this, it's two parts, right? Once you identify it, then what is the process that goes into it from there? So you identify the problem. What's the process of if that's something that you can even talk about, right?
So what we do is we employ the SARA model to help them to move through problem solving. So if we say trash is an issue, we identify the area, we identify the community resources or assets that we have that can help respond to that problem. If it's a city issue, we help them to identify those resources that empower them to make the changes that they need to in their community.
Okay, so now so you've got that, you're doing that part. You also mentioned that you make sure that there's a diverse, basically, response. So what do you mean by diverse?
So we don't, when policy or when problem solving or responses occur, we don't want just one dynamic present. We want to know what's going to help and what's sustainable for the community. We want a representation from everyone that's directly impacted by that issue.
Can I share that what we want to make certain is that there's no collateral damage?
Yes.
You know, if only one entity or one perspective is in the room and they address an issue in a particular way, they may not have taken into consideration what would happen should they do the thing that they decide is their response. So we want to make sure that everyone is in the space, has input, and works on a collaborative response so that, like I said, there's no collateral damage. If you say there's trash in the park and then instead of addressing the trash, you close the park, right? We want to make certain that those kinds of things don't happen.
So the park stays open, but let's
address the trash.
let's address it,
Right.
which I'm going to assume is bringing in the community as well as saying, hey, we're here to assist, but let's get everyone engaged and involved, and how do we get a group of people to come out and make sure that your community, where you live, right? So whether you're a stakeholder, and a lot of times, and just for clarification for people who may not know, when you're talking about stakeholders, you're talking about people who will own either property or a business. But communities are made up more than just stakeholders in terms of property owners or business owners. So it's making sure collectively, then I'm going to assume, does this involve even the business owners and everyone taking a part in it?
Yes. Young people,
Yes.
seniors, everyone.
So then with that response, how does that involve the outreach team? So are they coming in for that part, or is it? I was on outreach team for a while, obviously, though that was when it was through the city. So I don't know the process now with Urban League. So is that still going into in that area? Because if you identify, like you said, crime, so is that where the outreach team comes in?
We are a team at this point in time, and when we go into any neighborhood, we go in with both our community engagement specialists and our community outreach advocates. Our outreach advocates are more skilled in the violence reduction things that may need to occur. Our community engagement specialists are more skilled in the processes around figuring out what the problem is, engaging people to make it, to collaborate to make a difference, and together they impact what's going on in the community. Again, crime, disorder, and quality of life.
And both of those, God knows, in the situation we're in right now is really major. So let me ask you, Tiffany, are you going out are you literally boots on the ground? Are you going out in the streets and into the communities and having these conversations?
Yes.
So can you give me an idea of, not a real one, but just an idea of what those conversations may be like? Is that okay?
So if there's a shooting or a specific area in a neighborhood where there's high rate of shootings, we go into that neighborhood. We may start with the community council, identify those who may be on the safety committee or whatever the case may be, who want to work on those issues. And if it's something that they even see as an issue, we have to identify what it is that community sees as an issue. So we're there, we'll get in the mix. So if there's, if a certain block has a high rate of shooting, we'll find a way to how to bring positive traffic to that area to try to reduce the crime or reduce incidents of crime in that area. So yes, we're on the ground, we're engaged with the community, and we employ resources around whatever issues we're dealing with.
Okay. And, you know, I know a lot of times there's always seems to be somebody in the community doing something.
Mm-hmm.
Not always in every situation people that are qualified to handle a situation, right? Or sometimes you may have people who are qualified, not leadership who are qualified. I just want to mention, and I meant to do this in the beginning, Mrs. Smoot, but I was really excited to get this conversation started. And so what I wanted to do in the beginning was just to read a little of your bio, not a whole lot. It's definitely an impressive bio, but just to take out a piece of it. So if you don't mind, I'm going to kind of like backtrack. We're going to act like it's the beginning, even though it's not. And I'm just going to run down a little bit of your bio, because what you're doing, the work that you're doing, the organization is very vital. And so to make sure that people, I think it's important for people to feel, or at least have an idea, understanding of who is running something or who is over that, who is navigating the ship. So, like I said, we're gonna act like it's the beginning. I'm not gonna go through the whole other part, don't worry. I'm not gonna ask you about healthcare. Okay, I'm not gonna ask you about healthcare. I'm just gonna read a little bit of Mrs. Smoot's bio. As the executive director of the Community Policing Partners Center, or the Partnering Center, she's been there since 2012, and she supports a staff of 12 individuals committed to building bridges and relationships in Cincinnati neighborhoods, and that's really, really important. You've got to build the bridges, you've got to build relationships, because it's hard to get anything done without the two. Her team empowers community people to partner with the police and community stakeholders to utilize a transparent, inclusive process that helps to find community-driven solutions and issues of crime, disorder, and quality of life. This approach helps to build positive and supportive relationships between the community and the Cincinnati Police Department. And I think that's really important, because we're in this period of this counsel culture where we're counseling out everything. And I get the purpose for some of it, but what ends up happening sometimes is we forget that we are human, so we are perfectly imperfect. And as soon as someone trips, we're very quick now to dismiss people. Then you deal with, right now, I know there's the big thing, between Black Lives Matters and defunding the police department, and having, I think relationships in the community with the police and the community becomes real important. And having someone that can help build that bridge, that relationship, and then navigate that relationship, facilitate that relationship, I think becomes important to helping a community grow with law enforcement. Because at the end of the day, we know that across the country there are some crazy things going on with law enforcement. But also at the end of the day, if something happens to anybody, well, most people, you're going to pick up the phone, and who are you going to call? You're not calling Ghostbusters, you're calling the police because your house was robbed or there's an issue. So I think, and I'm glad I went back and read that, because for the Partnering Center to be doing this is something that becomes real important in building that. And I think that's one of the things that makes Cincinnati unique from some of the other cities across the country. We don't have a perfect police department, and we don't have perfect communities, but what we do have, at least it seems, that we have the community and the police working better together. Now, if we could get rid of the I'm not a snitch culture, that would be a better thing, but that's a whole different conversation, and that's not what I meant to go to, but I just had to throw that in. So thank you for letting me read that. How are you finding, Mrs. Smoot, the relationship with the communities and the police department? How are you seeing that in our city?
I would share that it's not as bad as you see on TV in most communities. I think we have our challenges because people make up communities and people make up police departments. And as a result of that, we can give that broad title to everyone, but I think it's in communities where law enforcement, police officers build relationships with those individuals, they do better. In communities where they don't build those relationships, they have challenges. In our city, we have people that are in all communities and in the police department, and so it depends on who you're talking to, in what community, and what their relationships have been like. But I would say as overall, better than most communities.
Okay. Oh, excuse me. I thought I kicked somebody. All right. So that's a good thing because it's like I said, for our city, compared to some cities, it is definitely a lot different. And like you said, what the advocates have been with the policing center now since December.
Mm-hmm.
And so I know from my time being there was a lot of work in trying to build that relationship on the street with the community and also trying to make it clear that, you know, every police officer or the police department, I'm not even say every, we know there are bad apples, but that it's not about, it's a you against them. It's about, it's a us for our city, and to keep that going. And I think that's real important for the policing center. The name, though, is interesting to me, the Community Police Partnering Center. So you're partnering with the police?
So that name came from the collaborative agreement. And it said, a friend of mine, Iris Rowley, would tell you that you always look for the capital C, and that stands for community. And that's the first part of our name, community. Now, I personally didn't understand that because I wasn't here in 2002, but I understand the concept of leading with community because the police are here to serve and protect us. And the community are here to set the standard for how they want to be policed in our community. And so I think it's important to recognize that we are the Community Police Partnering Center.
With the emphasis
on community.
Because it's very easy to get lost in the police, right? Community, you hear community, but then police jumps out like pow, right? And if you're not careful, that sticks. So thank you very much for definitely breaking that down and making that point, because I think it's important for people to understand. When people go, what's in a name, right? The name can mean a whole lot, and unfortunately sometimes the name can almost be deceiving or throw people off, and then their mind goes in a different way, and then that all of a sudden gets crazy. So I do appreciate you making that point for me. How the Urban League, right? So I know the community center, the community partnering center, community police partnering center, and then the Urban League. The Urban League, and some people may think Urban League is just Cincinnati, just here, but the Urban League is nationwide. Am I not mistaken?
We are an affiliate of the National Urban League, but every Urban League stands alone.
Oh, okay. So it's not. And thank you, because I was under the impression that they were all governed.
We are an affiliate
by one
of
body.
Yeah, we are an affiliate of an organization. We are self-governed, but an affiliate of an organization.
Okay, so it's a national organization, but autonomy in for each city has their own autonomy.
Yes.
And you have a new executive director.
Eddie Cohn.
What's his name?
Eddie Cohn.
Eddie Cohn. Okay, and so he's been here for a while, and that must be great and exciting. I'm just kind of trying to get some people, because everybody, I like to think that everybody knows everything, but realistically, we don't. And just to give people a little bit more information about the Urban League. And also for the purpose of getting more people to come out and know that the building, to know that the services are available. And, you know, the Bible says that my people perish for lack of knowledge. And so to try to make sure, one of the things we try to do here is to try to make sure we get as much knowledge and information and understanding to people. So thank you for that part. Derek,
Yes.
let me see.
It took you a while, brother. I thought we was here as bodyguards.
Oh, y'all aren't the bodyguards? I thought y'all were the bodyguards. What happened? Oh, okay. Well, I was going to let you know that I'm going to get to you and Elder Tony right after this break, but I thought it was important that we hear from the ladies. Oh, wow, that doesn't sound massage. Okay, I didn't, right? Okay. I'm looking to your boss. I want to be sure that it didn't sound that way. So what we're going to do is we're going to take a brief break. And then we're going to be right back, and we're going to continue this conversation because we have some more questions to ask. And I want to give everybody an opportunity to express how they feel about what's going on. If you have any upcoming events, because that's real important that you want to get people out to. We want your boots on the ground, but we need their boots on the ground as well, because as a community, we only work and function well when we're together. So listen, we're going to be right back. But until then, I just want to say this. If you're not able to stay with us, get insured. Get your health care. If you have Molina or CareSource, that's health insurance for some people that may not know. But if you don't have any of that and you don't have Medicaid, go get insured. I need you to do this in case you're gone when we come back. I need you to stay faithful and stay healthy.